Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained. I'm your host, Marie Betcher. I'm a registered nurse. I'm a former hospice nurse, and I started this podcast to educate patients and families on end of life and hospice. This is one of my episodes. I just want to bring up a few ideas. Things like, when did people start dying in hospitals more than they started dying at home? We have to go back to our medical history. From the 1870s to the 1920s, hospitals transitioned. They became not just a charitable institution for the poor, they became modern institutions of science and technology. They set the stage for sanitation, made it a safer place to be. As the years went by, hospitals were recognized also for curing diseases. And after World War II, women and extended family members were not available to care for and support the ill and the dying. So the increase in the availability of hospital beds encouraged individuals to be cared for in these institutions. I found a number when I was researching the internet, and it said that in 1949, so I'm not guaranteeing that this is an absolute, but it really seems pretty realistic, that in 1949, almost 50% of deaths in the United States occurred in institutions. In the past 40 years or more, people have kind of been transitioning back to wanting to die at home. My thoughts that I want to bring up is not whether you do or don't die in the hospital or die in a facility or die at home. Those are all okay choices. Nowadays, we have a lot of choice. If you're thinking about dying at home, things to think about are, would you use hospice? Understanding what hospice is, and that's what the point of my podcast is helping you understand hospice, how hospice can help you if you want to die at home, but hospice also helps you if you're at a facility, nursing home, adult family home, etc. They can even help in some cases in the hospital. It depends where you're at and your medical situation, but they can help. But remember, hospice is not your caregiver. You still need a loved one or a paid caregiver if you're going to be in the home, because end of life, there is just a greater need for personal care. So points to think about: if you're going to die at home, how are you going to get help? Will you have hospice involved? Will you have friends and family care for you? Does your provider know what you prefer? Does your family know what you prefer? Have the conversation before you need to. Don't wait until the doctor gives you bad news and you've got 72 hours. That's really a hard time to make something happen. Everybody's going to die. There should be some plans on who will take care of who as we age, so that we can all do it with grace and dignity. Thanks for listening to Hospice Explained. Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.